We have a surgery specifically tailored to bearded men as well, because we can just directly remove that. And the guys, they want a very, very fast recovery.
Male patients typically want to look rejuvenated, but they don't necessarily want a dramatic change.
Yeah, if you're going to consider having any surgical or any type of procedure abroad, safety has to be paramount. Because
As long as you have realistic expectations, it's sometimes hard to maintain that all the time. Even professional athletes don't necessarily always have a six pack that's highly chiseled.
Beauty scientists Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Welcome to the Beauty Scientist. I'm Dr. Kristy Hamilton, board certified plastic surgeon, here with my fellow board certified plastic surgeon, Dr. Roy Kim. We are the Beauty Scientists, and we are discussing today plastic surgery for men, because men do these things too. And we often are focused on women and what women are doing, but some plastic surgeons' practices are completely devoted to men. I was reviewing the ASPS, or American Society of Plastic Surgeons, statistics, and in 2023, there was a 6% increase in the total number of cosmetic procedures performed for men. And then specifically, there was an increase focused on body procedures as well as face procedures. So why do you think this is, Dr. Kim? Are you seeing more men in your office? And we'll start with that.
Yes, I'm definitely seeing more men in my office. I think the biggest thing is societal trends and also looking good when you feel good inside. So we can't fully stop external aging. And so a lot of men work out, they have a good diet, and they actually physically look good overall. But in terms of aging, in terms of your face, your body, certain things you can't actually reverse, you need surgery. I do think with the increase of weight loss, specifically semaglutide, Ozempic, Mounjaro, and all that stuff, there are a subgroup of male and female patients who have lost a lot of weight. They have loose skin, and we both know if you have a lot of loose skin, there's no way to tighten that up except with surgery.
And we've talked about liposuction, body lifts, tummy tucks before. Are there any specific surgeries, body surgeries for men after weight loss like that?
Yeah, I think the biggest one is probably gynecomastia, which is sort of one of the secret discussions that men have, but it's definitely an issue. So gynecomastia is a medical condition where your breast tissue grows. And we don't know why, but there's definitely been a massive increase of this, at least in the West and in the United States. So some patients, they want it treated, but a lot of patients, they've lost the weight, whether diet, working out, combination of both, and they still have excess breast tissue. So that type of body reshaping is becoming increasingly much more common, much more asked about. And that is a huge, huge issue in the male community. I think the second thing is with social media, or the desire to actually look as good as possible. They want the core muscles to actually reflect how they feel. And so it's hard to get a six pack, even with low body weight. And so if you need a little push, then we can do that with liposculpture and liposuction.
And when you're assessing the male body, obviously very different aesthetic than the female body, what are you trying to create when you are doing male surgical body contouring? What are the features you're looking for?
I think that you have to obviously talk carefully to the man and ask them exactly if they can maintain their diet and lifestyle and exercise regimen after surgery, because it's so important with the breast body areas. Finally, in terms of the overall look, I do think that men want to have a more chiseled look than women. So in other words, women, they don't mind a six pack, but it's not like a huge goal of theirs. Whereas for men, they want a masculine looking chest, wide shoulders. They want a core muscle that reflects that. As long as you have realistic expectations, it's sometimes hard to maintain that all the time. Even professional athletes don't necessarily always have a six pack that's highly chiseled. It's chiseled for a photo shoot when they're dehydrated. So as long as male patients understand that, then they have really good results. But we always start with very good expectations beforehand.
Yes, and then the surgeries have really evolved too. So before there was a lot of it, this kind of went around on social media too, like carving abs out of fat though. So it end up, if you gain weight to your point and don't maintain your lifestyle, then you can end up with like little butter stick abs. And it's not really quite the aesthetic we're going for. Now, when we do the liposuction, we may keep that fat, for example, and then inject it into the muscle itself. So instead of creating kind of fake abs on top of your muscles out of fat, we're augmenting the musculature. This yields a much more natural look. And this hasn't been proven yet, but there are some people, some surgeons that think that that fat kind of ends up fueling the muscle too. So as long as your patient actually then goes back to the gym and they're working out their deltoids or biceps, they can take that fat that was injected there and almost use it as direct nutrition for their muscle building. And patients who then get excited about their diet, excited about their exercise, that can really help accentuate that like V-shaped torso, more muscular aesthetic than our female patients that are going for like a softer, more feminine hourglass. What about for facial surgery? What are the most popular facial operations that you perform for men?
I still think a lot of men are hesitant to undergo a large change. A lot of my male patients get injectables, less invasive or non-invasives, and increasingly, definitely higher frequency of smaller procedures, smaller being defined as eyelid lift. So it sounds strange, but at least in Silicon Valley, there are a lot of people who aren't that old, but they're managing 20-year-old, 25-year-old coders. And so there's actually a lot of pressure on male managers to actually look younger. And so with injectables, you can actually look younger. With better skincare, you can look younger. And with laser peel, things of that nature, you don't have surgery, you don't have as much time off, and you can still look younger and better. Eyelid lift, I think, is the biggest bang for the buck in terms of male facial aesthetics, because if you have less loose skin around your upper and lower eyelid, you will look younger. The bigger procedures, I am increasingly, slowly, not a huge increase, but definitely an increase in terms of rhinoplasty and facelifts, because rhinoplasty can occur at any age. They want to look sort of harmonious to the rest of their face. With facelift, older patients, male patients typically want to look rejuvenated, but they don't necessarily want a dramatic change. And I think in men, a lot of men really focus on the neck and jawline a little more than women when they get a male facelift.
I completely agree, and I think the motivations for surgery, like you were saying, very different. They want to feel and look. They want to look as vigorous as they feel. They don't want people at work asking them why they're tired, or they want to feel like that invigorated look and that have that translate to the workplace. And I agree with you. I think this area, the so-called turkey gobbler, very very bothersome to a lot of men. And that's why we have a surgery specifically tailored to bearded men as well, because we can just directly remove that. And the guys, they want a very very fast recovery. My male patients are not willing to accept like weeks of swelling. They want something where they can get it done and they're back in the gym very very quickly, getting back to their exercise regimen, because these are like, they're usually executives, pretty like high powered men. And I agree with you. I think eye lift as well, very powerful, just makes you look bright and alive, and always a very subtle natural aesthetic. What about, I think another major one that's been popular for some time but even more so lately, what do you think about hair transplantation and the other options up there?
Yeah, I think that definitely more and more men are looking into it. And sadly, or unfortunately for our US colleagues, they're going overseas to get it done, because the medical options for hair loss are definitely increasing. So we all know that minoxidil works and Propecia / the generic works. The issue is discipline. You have to do it every day for forever. And sometimes it works, but not as well as you want. Male pattern baldness, in a good way, is more predictable in terms of where you have your hair loss, and it's actually more predictable on where you need to apply the medication. We also have, of course, PRP, we have exosomes, other things which actually help with hair regeneration. If you have an area that's totally bald, in other words, it's skin or it's scalp, then yeah, hair transplantation is the way to go. And FUE, follicular extraction, as well as really just doing one single hair at a time, is the way to go if you're a candidate. The issue, I think, in the US is that the cost of labor is so high that it's a much higher cost. As long as you can find some place overseas that's reputable, the labor costs are so much lower overseas that you can fly out there, get it done. Doesn't require a ton of post-op care, and you have a great result. I think on social media, on TikTok, on all these other video like YouTube platforms, I think the biggest issue, honestly, is finding a reputable place, because even okay results, I they show video of the actual procedure. I don't think it's okay. I don't think it's that clean. I don't think they did a great job with the grafts. I don't think that they put it in densely enough. I could go on and on and on. So I think those subtleties may be missed to the average consumer, but it's definitely increasing.
Yeah, if you're going to consider having any surgical or any type of procedure abroad, safety has to be paramount, because if you're going to a board certified specialist in the United States, like, you can accept like a minimum, very high level of safety. Maybe everyone's got a different aesthetic and different cosmetic result that you may get, but you're going to go through the process and come out on the other side. You should be a little careful when you're going abroad. Make sure you do your research very, very well. So, but hair transplant and just having a full head of hair, also symbol of youth. It's a can be a significant confidence boost. And I know, especially sometimes younger men going bald, they feel like it just makes them look so much older than they actually are. It can be bothersome even in dating. But so we see a lot of surgery for men to kind of maintain a competitive edge, and have the outside reflect how good they feel on the inside. So I enjoy my male patients. I think they're very specific. They come in like they're busy. They know exactly what they want, and they just want to know when they can do it, how quickly they can recover, and when they can get back into the gym. Typically, is the questions I get.
Yeah. Typically, I don't know if they do more research. They do a lot of research. They sort of know what they want. They're totally willing to hear what you have to say. But especially for more straightforward procedures, they know what they want, and they just want to know, when can I get it done? And you're right about getting back to the gym. Most of my male patients are very much into health and fitness, and they're a
Yeah.
pleasure to work with because they recover faster.
Yeah. And just having that, like, I love when I hear that, because I know that their baseline is so healthy that they're going to cruise through the recovery process. So I love my male patients, and they're great. I also love my female patients, but just different mindset.
Yes.
Plastic surgery for men, increasing body of patients, increasingly a target of the cosmetic industry in general, the injectables companies. I expect we'll be doing more and more of that as the years go by. And I very much appreciate the male plastic surgeon perspective on this, Dr. Kim.
Oh,
So
yeah. It's a lot of fun with the male patients. So,
yeah, they're wonderful. So if you have any questions about specific procedures, let us know. We can make episodes on that. But we hope you enjoyed this episode of The Beauty Scientist on male plastic surgery, and stay beautiful.
stay beautiful.
Thank you for joining us on The Beauty Scientist. Be sure to visit thebeautyscientist.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.